So that was a photo of myself and my little sister. I must have been 3, so it was about 20 years ago. Or maybe a little bit more. So I really appreciate the organizers inviting me to present, and it's really a privilege to have this opportunity to present findings on a research project on national priority and capacity to address child sexual abuse in 6 countries. And we all want to thank the Oak Foundation for supporting this research. This is an independent research project, and the perspectives I offer don't necessarily represent those of the funder. I should note that I am not an expert on child protection or child sexual abuse. I'm a political scientist by training, and I study the politics of health and social policy making nationally and globally, especially in low-income countries. But I hope you find the political science perspective offered in this talk to be of value for thinking about political influences on and strategies to prevent and address child sexual abuse. So, child sexual abuse is a serious global problem, as everyone knows. A recent study in The Lancet found that globally, approximately 1 in 5 girls and 1 in 7 boys has experienced sexual violence. There's a substantial amount of research on the technical dimensions of the issue, including on prevalence, interventions, and policy. The issue is more than a technical matter, however. It's also a political problem, as any activist knows. Most governments across the world do not give the issue sufficient attention and resources. The reasons are often political and social. Among these reasons are cultures of silence, invisibility, and indifference that preclude public discussion of the issue, resistance from leaders of powerful institutions, often religious institutions, and competition for scarce resources with other pressing national problems. Because we know little about the political factors shaping priority for addressing child sexual abuse, we decided to pursue a study on this subject. The orienting question for our study is here, and I'll give you a moment to read it. So the 6 countries we decided to study are listed here. We selected these 6 because we found some evidence of political momentum to address the issue in each, and thought that these countries' experiences might offer insight for other countries. To carry out the research, we assembled a multidisciplinary team that includes political scientists, psychologists, and social work experts, among others. We come from research institutions in South Africa, Bolivia, Chile, Germany, the United Arab Emirates, and the United States. We used qualitative methods to conduct historically oriented case studies of each of the countries. These studies were grounded in key informant interviews with government and civil society actors involved in addressing child sexual abuse, approximately 150 interviews in total, supplemented by analysis of documents. So let me highlight the top-line results from our study. Our findings indicate that the factors that shape the extent to which national priority and capacity emerge for addressing child sexual abuse fall into 2 large buckets, external and internal, encompassing 5 categories: norms, political legacies, scandals, political action, and technical action. External influences pertain to factors concerning context that are not largely under the control of proponents concerned with addressing and preventing child sexual abuse, but are factors that proponents nevertheless must be cognizant of if they hope to devise effective political strategies to address the issue. Internal influences pertain to the strategies of proponents themselves, factors over which they have considerable control. When we say proponents, we mean the individuals and organizations centrally concerned with preventing and addressing child sexual abuse, including, among others, non-governmental organizations, survivor activists, researchers, civil servants in government, national political leaders, international organizations, and funders. I would like to now speak to each of these 5 categories in greater depth and illustrate with evidence from our national case studies their influence on priority and capacity. First, I'll discuss the 3 categories of external influences: norms, political legacies, and scandals. The first category of external factors are norms. Norms are widely held beliefs about appropriate behavior. Several norms pertaining to childhood result in many countries in cultures of silence, invisibility, and indifference concerning child sexual abuse, posing barriers to generating political priority for the issue. Among these norms is adult centrism, the privileging of the perspective of adults over those of children, and the idea that children are objects to be controlled rather than rights-bearing individuals. Another such norm is patriarchy, a belief in the appropriateness of male domination over women and children. A third norm is privacy, the idea that an issue is not a legitimate one for public discussion and government attention and should be handled within the private sphere, especially the family. These norms conspire to silence public attention to child sexual abuse in many countries. For instance, in the United Arab Emirates, the idea of protecting family honor is strong and has proven to be a barrier to supporting survivors and bringing perpetrators to justice. In Germany, the country's difficult past, including the legacy of the Nazi regime and the East German state police, have created understandable concerns about privacy and state surveillance. But these concerns have also led to strict data protection laws, which have hindered efforts to combat newer forms of online exploitation. A strategic consideration for proponents concerned with addressing child sexual abuse is how to develop culturally appropriate strategies that can crack these cultures of silence. The second external category of factors are political legacies. Our findings point to the complexities of generating attention under autocratic regimes and the positive effects of democratization on the likelihood of priority emerging for the issue. In South Africa, for instance, meaningful attention to child protection and child sexual abuse did not emerge until the toppling of apartheid, the emergence of democracy, and the prioritization of children's rights under Nelson Mandela. In Chile, it was nearly impossible to generate political attention to the issue until the Pinochet dictatorship was overthrown. The strategic consideration pertaining to political legacies is not that proponents concerned with child sexual abuse must wait for regime transition, although regime transition away from autocracy certainly helps. It is rather that political context needs to be considered carefully in devising strategy. Progress is possible under autocratic regimes, but strategies have to be devised in ways that account for the constricted political space. The third external factor are scandals, events regarded as moral transgressions that cause public outrage. In each of the 6 countries we studied, 1 or more child sexual abuse scandals occurred, and I list some here. These resulted, in most cases, in an upswing in government and public attention to the issue. We say this is an external factor, but in some instances, it can be considered an internal factor in that proponents fighting child sexual abuse are the ones who brought the abuse to public attention. There are some complex issues surrounding the agenda-setting effects of scandals, however. After all, most instances of child sexual abuse remain hidden and do not spark public outrage. This raises the question as to what gets counted as a scandal. That is, under what circumstances will an instance of abuse get public notice? We don't have a complete answer to this, but it does appear that the social position of survivors may matter, If they come from groups with access to resources and political power, rather than from marginalized communities, they may be more likely to get a hearing and to be able to advocate on their own behalf. Also, if the perpetrator is well known, that likely facilitates attention. And if the transgression is particularly egregious, such as the rape of a baby, as occurred in a well-publicized case in South Africa, the political system may be more likely to respond. The strategic consideration for proponents concerned with child sexual abuse is how to take advantage of the policy windows that open when scandals occur to move the political system to offer sustained attention to the issue. For instance, having solutions ready at hand, data available to show the severity of the problem, and forums in which proponents can congregate to coordinate action. These opportunities can be squandered, or they can be leveraged to generate political momentum. Let me now turn to findings on two categories of factors that are internal. That is, they concern the strategies of proponents themselves. These are political action and technical action. Political action can be in turn understood in terms of four dimensions: political and bureaucratic leadership, social activism, international pressure, and links with child protection sectors. The first of those four: when senior political leaders, either of their own accord or because they were convinced by others of the importance of the issue, have demanded action, they have often moved their political systems. For instance, shortly after ascending to power, Nelson Mandela prioritized children's rights and established a powerful Office on the Rights of the Children within the presidency. After becoming aware of two child sexual abuse imagery and murder cases and meeting with parents of the victims, in 2015, former British Prime Minister David Cameron designated child sexual abuse one of three national threats. And former Chilean President Michelle Bachelet, a pediatrician, made children a policy priority with positive effects for policy on sexual violence against children. The second element under political action is social activism. Priority is not solely a function of action at the top of the political system. It also comes from civil society pressure. For instance, advocacy by survivors in Chile and Germany has been critical for generating political attention to the issue. So too has advocacy by women's movements in these two countries. By contrast, a strong movement to fight gender-based violence in South Africa has offered little space for addressing violence against children. These examples suggest a complex relationship between women's movements on the one hand and the fight against child sexual abuse on the other that deserves additional research, attention, and scrutiny. Sometimes the impetus to address child sexual abuse has been shaped from forces outside the country interacting with domestic forces. For instance, Brisa de Angulo, who was sexually assaulted by a family member at age 15 and denied justice by the Bolivian state, won a case against the state in the Inter-American Court of Human Rights, obligating the state to make legal reforms. She also has led a grassroots mobilization in the country. Another example is the BRAVE movement, launched in 2022, a global movement of survivors and allies fighting sexual violence against children and adolescents that has pushed governments, industry, and other actors to take action. Yet another dimension of political action has been the relationship between proponents focused on child sexual abuse specifically and the broader child protection sector. In Germany, the United Kingdom, and Chile, distinct child sexual abuse policy communities have formed, and by focusing on this issue specifically, been central to advancing attention to the issue. In South Africa and the United Arab Emirates, these policy communities are very small and embedded within larger child protection communities. That integration has had some positive effects, lifting child sexual abuse as an issue in ways that proponents could not have done so by themselves. But it's also had negative effects. The issue gets lost amidst the wide array of child protection issues that these countries face. Many strategic considerations emerge from this evidence on factors connected to political action that shape attention for addressing child sexual abuse. But perhaps the primary one is the need for the creation of broad political coalitions, ones that link actors in civil society with allies in government, to create a powerful political force pushing government and society to devote attention and resources to the issue. Not all action that leads to attention is overtly political. The day-to-day work of NGOs, researchers, and others in estimating prevalence, studying interventions, and proposing policy solutions also has had agenda-setting effects. These kinds of technical policy communities have formed in Chile and the United Kingdom, and their work has influenced national attention to child sexual abuse. The strategic consideration here is to support the day-to-day work of technical experts, who through the detection of prevalence make the problem visible, and through the development and testing of interventions make the problem tractable, thereby making it more likely that policymakers will act on the issue. I have so far been reporting on our findings pertaining to priority, the attention and resources the political system gives to the issue. An equally critical aspect is capacity, the ability of state and social institutions to carry out policy. Just because government attention emerges, resources are provided, and policy is enacted, does not mean initiatives will be implemented effectively and populations reached. And indeed, our findings revealed considerable problems with respect to capacity of governments to carry out policy, particularly in the countries we studied that were resource constrained. Among the problems we found were governments, even the richer ones, providing insufficient budgets for the issue being assigned to ministries, typically ones concerned with social policy, that are politically weak and lack the capacity to exercise leadership on the issue and bring all relevant government agencies together. And in several countries, a severe shortage of workers capable of addressing the issue, particularly social workers. I want to conclude by reiterating top-line implications of our findings. First, addressing child sexual abuse is as much a political challenge as a technical one. And just as they develop technical strategies, proponents need to develop political strategies to ensure government and social attention to the issue. Second, priority does not emerge from any single factor. There's no magic bullet. Such, for instance, the attention that a country's foremost political leader may happen to give the issue. Rather, in every case, it arises from a confluence of factors connected to normative shifts, political developments, scandals, political action, and technical action. Third, we must attend to the institutional capacity of governments and social organizations to address child sexual abuse, not just whether we've the right policy on the books. And finally, I want to end by posing 5 questions about strategy to proponents, for proponents, to think about that emerge from our findings. I think posing these questions for deliberation is more valuable than attempting to offer universal prescriptions, which tend not to be valid given the great differences in national, political, and social contexts. So I'll give you a moment to read these and perhaps take a moment to contemplate the answers for your own national political context. Let me give you a moment. Thank you very much.